Hey everyone, this is Daily Dose of Medicine. Today we will talk about actinic keratosis, also known as solar keratosis. We will talk about the causes, treatment, prevention, and symptoms. Stay tuned till the end to learn more about this condition. It's known as solar keratosis also. It's precancerous and it's caused by long-term exposure to UV radiation, which is typically from sun or tanning beds. It's not cancer, but it can progress to squamous cell carcinoma, which is a type of skin cancer if left untreated. It will usually present as a rough, scaly patch or bump, and common sites for this issue is face, ears, scalp, neck, forearms, hands, and lips, areas which are frequently exposed to the sun. Here you see an example of scalp actinic keratosis. We said it can progress to malignancy, it can progress to squamous cell carcinoma, but what's the risk? For immunocompetent patients, for people who have strong immune system, per lesion annual risk is around 0.03, 0.075%. So yearly this is the risk, but the data differs from source to source. The risk is markedly higher for people who are immunosuppressed, particularly patients who had solid organ transplant. They experience 50-fold increased risk of keratinocyte cancers. Symptoms include rough, dry, or scaly patches, like we said. It may be pink, red, brown, or skin-colored. It will feel like sandpaper. It can itch, sting, or bleed, and it's sometimes mistaken for acne or persistent sore. Regarding diagnosis, we diagnose this by clinical exam, but sometimes we do skin biopsy to rule out cancer. Prevention is very important, and prevention and treatment strategies differ between patients who are immunocompetent or immunosuppressed, but both groups will benefit from combination of photoprotection, lesion-directed therapies, and field-directed treatments. Regarding the prevention, like we said, it's very important, reason being the lesions might recur and the treatment is not always successful. We should use broad-spectrum sunscreen, especially for suffering from this condition. Wear protective clothing, avoid tanning beds. You can take nicotinamide supplements. It may reduce new actinic keratosis and cutaneous squamous cell carcinoma risk, but its benefit is modest and best supported in high-risk patients. Regular skin exams are important and recommended for early detection and management. And when it comes to treatment, we will talk mainly about immunocompetent individuals. The choice of therapy is guided by the number, location, thickness of the lesions, as well as patient preference and tolerability. Lesion-directed therapies like cryotherapy are preferred for isolated type, while field-directed therapies are indicated for multiple or confluent lesions. Cryotherapy is something we use for isolated lesions. We do this with liquid nitrogen. It is basically a treatment that uses extreme cold to freeze and destroy abnormal tissue. But efficacy of this is very limited in field disease. For field disease, we do use 5-FU, imiquimod, and photodynamic therapy usually, and topical 5-FU is the most effective field therapy with complete clearance rates of 50 to 70% for facial and scalp type. But local skin reactions might occur with this, like erythema, erosion, and discomfort. Imiquimod can also be used. It might offer a favorable cosmetic profile, though local inflammation is also frequent. Photodynamic therapy, we usually do this with ALA or MAL, They're highly effective for field cancerization and excellent cosmetic outcomes. But like I said at the end, for the field therapy, 5FU has been shown to be most effective. And for the isolated lesions, we generally use cryotherapy. Thank you so much for watching. Don't forget to join our channel membership and watch our videos on other skin conditions. And I'll see you on the next video.